We are going through more high-yield practice questions for neurocognitive disorders so that you don't miss any on your exam. These are harder than the last video. Question 1. A 68-year-old man presents with progressive memory loss over 2 years. He has difficulty remembering recent conversations and frequently misplaces objects. His father developed similar symptoms in his late 60s. Genetic testing revealed a polymorphism associated with the increased risk of late-onset disease. Which of the following is the most likely genetic association? A. Mutation in presenilin-1. B. Apolipoprotein E4 allele. C. Alpha-synuclein gene mutation. Or D. Huntington gene CAG repeat expansion. The answer is B. Apolipoprotein E4 allele. The apoprotein EE4 allele is the strongest risk factor for late-onset Alzheimer's, and you will be tested on this. It's important to note that presenilin-1 is associated with early-onset familiar Alzheimer's, and you also may be asked on this as well. So know the difference between those two. Know that ApoE is for the late onset, whereas presenilin is for the early onset. Question 2. A 78-year-old man with a 2-year history of Alzheimer's disease presents with acute confusion over 24 hours. He is inattentive and fluctuates in his alertness. What is the diagnosis? A. Alzheimer's progression. B. Delirium superimposed on dementia. C. Lewy body dementia. Or D. Depression. The answer is delirium superimposed on dementia. They may ask you a question like this. So delirium, you're going to see an acute change, even with a baseline of dementia. So if you have a patient that at baseline has some cognitive decline, but then they get acutely worse and have this fluctuating in attention and alertness, then the answer is dementia. Question 3. A 75-year-old man with hypertension and diabetes presents with cognitive decline. MRI shows multiple infarcts in the cortical and subcortical regions. What is the most likely diagnosis? A. Alzheimer's disease. B. Lewy body dementia. C. Vascular dementia. D. Frontotemporal dementia. Or E. Parkinson's disease dementia. The answer is C. Vascular dementia. The key things to remember for vascular dementia for your exam is it causes a stepwise decline. The patient is going to have vascular risk factors such as diabetes, and they're going to have these little infarcts in their brain, which is why you're going to see those little white spots on the MRI. Question 4. A patient with dementia develops severe rigidity after a low-dose Haldol. Which of the following diagnoses does the patient most likely have? A. Alzheimer's disease. B. Lewy body dementia. C. Vascular dementia. Or D. Frontotemporal dementia. The answer is Lewy body dementia. It's important to know for your exam that Lewy body dementia can have severe antipsychotic sensitivity. And this is because patients with Lewy body dementia already have a dopamine deficiency, which is why they have those Parkinson symptoms later on in the disease. Since antipsychotics block dopamine, it further worsens those Parkinson's symptoms. Question 5. A patient has rapidly progressive cognitive decline and then dies. The histology slide shows spongiform change, neuronal loss, and reactive astrocytic gliosis. What was the cause of the patient's symptoms? A. Alzheimer's disease. B. Frontotemporal dementia. C. Lewy body dementia. Or D. prion disease. The answer is prion disease. So the examiners will either describe what the slide looks like or will show you a picture like I have here. Be familiar with both because they love to test on prion disease and what it looks like. Question 6. A hospitalized patient with delirium is pulling out IVs and is punching the nurses. The staff attempt verbal redirection, but the patient continues to act violently. What is the next best step? A. Treat the cause only. B. Give Haldol. C. Give a benzodiazepine. Or D. Start an SSRI. The answer is give Haldol. If the patient is dangerous while they're delirious, you have to treat the agitation first so that they don't hurt themselves or someone else. You want to eventually treat the underlying cause like antibiotics if it's a UTI, but first give Haldol. Another trick is the benzodiazepine. You never give benzodiazepine to someone with delirium unless they have delirium tremens from alcohol withdrawal, because delirium can be worsened by benzodiazepines. Question 7. A 68-year-old patient presents with gait instability, urinary incontinence, and dementia. Imaging shows enlarged ventricles. What is the next best step? A. Start them on donepezil. B. Perform a lumbar puncture trial. C. Give them Haldol. Or D. Start an SSRI. The answer is perform a lumbar puncture trial. Why? Because this person has normal pressure hydrocephalus. And if you do a large volume lumbar puncture on them, then it can remove the CSF temporarily and their symptoms should improve, especially their gait. And it predicts the benefit of a VP shunt. So for normal pressure hydrocephalus, you have to know for the exam, lumbar punctures and VP shunts. Question 8. A daughter brings in her 71-year-old mother to the clinic due to memory issues. The patient has had memory complaints since her husband died 2 months ago and shows a low interest in doing things. Upon interview, the patient answers, "I don't know," to many of the questions. What is the diagnosis? A. Alzheimer's dementia. B. Depression. C. Delirium. Or D. Frontotemporal dementia. The answer is B. Depression. This is also known as pseudodementia in the elderly patients. It will look a lot like dementia, but in these patients, there tends to be signs of depression, such as a low interest in doing things. There might be something that caused the depression within the vignette. And they'll answer, "I don't know," due to a lack of effort rather than actually not knowing and confabulating like you would see in dementia. That's high yield. Question 9. A 66-year-old man has rapidly progressive cognitive decline. He was previously independent but now has difficulty recognizing family members and performing basic tasks. His wife reports that he developed sudden, brief, jerky movements of his arms. On exam, he is disoriented and has intermittent myoclonus. MRI of the brain is unremarkable. EEG shows periodic sharp wave complexes. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Lewy body dementia. C. Creutzfeldt-Jakob disease. Or D. Frontotemporal dementia. The answer is C. Creutzfeldt-Jakob disease. So this is a prion disease, and the key things to be on the lookout for are the rapidly progressive dementia over weeks to months, so it's very rapid, plus the myoclonus is key. And then you have to know the EEG findings, which are periodic sharp wave complexes. The time course is the most important clue because it is so rapid. Be sure to watch the full dementia video with more high-yield facts and subscribe for new videos every week. Good luck.